St. Joe's Hospital, Pavarti, Nair Hospital, Kaiparamba, and Raja Hospital, Chavakar. Today I am going to talk about chronic adenotonsillitis. Adenotonsils are lymphoid tissues which are seen in the behind the nose and in the throat area. So these helps in immunity and helps to fight infection. But sometimes in children especially, we see that it has caused a lot of trouble. It causes recurrent, it is the main cause of recurrent upper respiratory tract infections. And many other symptoms like mouth breathing, snoring, loss of concentration. It causes the tooth to be protruded and crowded. The classic adenoid facies, which is seen when there is adenoids hypertrophy. So, how does we have these adenoids, which is classically present right behind the nose, which is in this area, and what happens is when the adenoids are hypertrophied, it can cause many complaints. Like the child might have recurrent ear infections, and because of this adenoids blocking the eustachian tube, that is the opening from the ear, it causes recurrent ear infection and hearing loss, and this needs to be addressed. And it can also cause recurrent upper respiratory tract infection, running nose, nose block. The child sleeps in abnormal positions because of the difficulty in breathing. And the tonsils can cause recurrent infections in the throat, and that can also affect the throat. So, coming to the diagnosis or the findings, we can come to the conclusion or the diagnosis by two methods. One is by nasal endoscopy, where we pass a small camera through the nose and we check how much obstruction is there in the behind the nose area. So this is graded as per the Clement staging. The Clement staging is used for the grading system. And for tonsils, we can just assess it by using a headlight, and we can grade the tonsils. That's also possible through Brodsky's grading system. And there are many other methods of assessment of the adenoids, and the other method is by the simple X-ray. But to be more clear, it is always better to go for endoscopic evaluation. After we diagnose or we come to a grading system, we can also check the hearing. That is through our audiological tests. We do the pure tone audiogram and the tympanometry. And as per if it is a child, we do the audiometry like play audiometry and other methods to find out if the child has hearing loss. And it's also important to evaluate the ear when the patient has and the child has adenoids and tonsils. So next is management. For managing adenotonsillitis, we can use medications for adenoids like nasal sprays. These are steroid nasal sprays which have local effects on the nose. And if the child is not improving symptomatically, then we might have to go for surgery, which is again the surgery can be done in different ways like coagulation. That is the latest method which we use, where we use the coagulation wand, and it is more relatively bloodless and painless technique. And for the tonsils also, we have different methods where we can remove the tonsils. Now, I know all of you all would be asking, if we remove the adenoids and tonsils, what will the child, how will the immunity work for the child? See, adenoids and tonsils are actually the source of bacteria and virus, and this is the reason why the child is having recurrent infections. So once we remove the adenoids and tonsils, the infection rate will come down a lot, and symptom wise there is a lot of improvement when we remove the adenoids and tonsils, and the immunity is fully developed, and we do not have to be concerned, as the adenoids and tonsils are doing more harm to the child than good. And after the surgery, you will, I'm sure you all have queries about the complications of the surgeries. This surgery is one of the basic surgeries in ENT, and bleeding is one of the common complications which can be managed by good surgical techniques, and injury to the teeth and the surrounding structures, and that can also be managed. There is no very severe complications for the surgery. Recurrence is like around very small percentage of recurrence is possible, especially in adenoids, and the other complications is like muscle injury and other things, which is very rare. So I hope I have come to a conclusion with all of your queries. Thank you.